Question 1. A veteran technician who has exclusively worked in the prep and pack area for 3 years is recently transferred to the decontamination area. According to Human Resources and Department policies, when must formal training and competency verification occur for this employee? A. Only during the annual departmental review period. B. Immediately, as formal training is required for both new hires and employees moving to new positions. C. Within 6 months of the transfer to allow for hands-on adjustment. D. Never, because the technician already has 3 years of General Sterile Processing Department, SPD, experience. Correct answer B. Knowledge point explanation. Core rationale. Formal training is legally and operationally mandated not only for brand new employees but also for any existing staff member transitioning to a new role or area within the department to ensure they understand the specific equipment and protocols of that new zone. Trap analysis. Option A is incorrect because waiting for an annual review leaves a dangerous gap where the technician is working without verified skills in a high-risk area. Option C is incorrect because 6 months is far too long to delay mandatory safety and process training. It must happen before independent work begins. Option D is incorrect because experience in the clean assembly side does not equate to competency with complex decontamination machinery, such as ultrasonic cleaners or automated washers. Concept extension. All training must be meticulously documented in the employee's file, typically as a competency checklist, which serves as legal proof of their capability during agency audits. Question 2. To ensure compliance with legal and regulatory standards, how must all sterilization monitoring logs and physical printouts be maintained by the technician? A. They must be electronically scanned and immediately shredded. B. They must be signed by the department manager before the end of the shift. C. They must be consistently accurate, highly legible, and entirely complete. D. They must be stored in a 75-degree Fahrenheit, F, climate-controlled safe. Correct answer C. Knowledge point explanation. Core rationale. Sterilization records are critical legal documents that trace patient safety. They must be perfectly accurate, legible, easy to read by anyone, and complete with no missing data points like time, temperature, or the operator's initials. Trap analysis. Option A is incorrect because while electronic scanning is common, physical original records are often required to be retained for a specific legal period before shredding. Option B is incorrect because the technician who operated the sterilizer must sign or initial the printout to verify the parameters, not necessarily the manager. Option D is incorrect because while 75 degrees Fahrenheit is a standard for sterile storage room temperature, records are kept in standard filing systems or digital databases, not necessarily a climate-controlled safe. Concept extension. If a mistake is made on a physical written log, the technician should draw a single line through the error, correct it, and initial the change, never using correction fluid. Question 3. During a routine audit of the sterilizer control log, an inspector is reviewing the documentation for a specific 270-degree Fahrenheit, F, steam sterilization cycle. To ensure full traceability of the processed instruments, what crucial information must the technician have documented in this specific load record? A. The precise items and the exact quantities of the instruments sterilized. B. The exact weight of each wrapped package in pounds. C. The detailed preventative maintenance history of the sterilizer unit. D. The specific brand of the biological indicator, BI, incubator used. Correct answer A. Knowledge point explanation. Core rationale. The core purpose of a load record is traceability. It must clearly list exactly what was in the chamber, e.g., 3 major orthopedic trays, 5 soft tissue sets, and the total quantity, linking those specific items directly to that successful cycle in case of a recall. Trap analysis. Option B is incorrect because while a maximum weight limit exists, usually 25 pounds for trays, the exact weight of every individual package is not required in the daily cycle log. Option C is incorrect because preventative maintenance records are kept in a separate equipment file, not within the daily load documentation. Option D is incorrect because the incubator brand is irrelevant to the cycle load log. The BI lot number and result are recorded, but not the incubator's manufacturer. Concept extension. In addition to items and quantities, the load record must match the lot control number, which includes the sterilizer ID, cycle number, and Julian date. Question 4. What is the primary function of a Type 1 chemical indicator, such as autoclave tape, when placed on the outside of a rigid container or wrapped package? A. To guarantee that the contents inside the package are completely sterile. B. To visually differentiate items that have been exposed to a sterilization process from unexposed items. C. To measure the exact steam penetration at the geometric center of the set. D. To lock the container securely and prevent unauthorized tampering. Correct answer B. Knowledge point explanation. Core rationale. External indicators, Type 1 process indicators, simply react to temperature to show that the package physically passed through the sterilizer chamber. This prevents technicians from accidentally mistaking an unsterilized tray on a cooling cart for a processed one. Trap analysis. Option A is incorrect because chemical indicators cannot prove sterility or lethality. Only biological indicators can guarantee that microorganisms were killed. Option C is incorrect because measuring steam penetration at the center of the set is the job of an internal chemical indicator, like a Type 5 integrator, not an external tape. Option D is incorrect because tamper-evident locks are physical plastic devices used on rigid containers. Indicator tape is not designed to function as a physical security lock. Concept extension. If the external indicator is missing, incomplete, or fails to change color, the item must be considered unsterile and sent back to decontamination for full reprocessing. Question 5. A technician is assigned to the sterile storage area, where the temperature must not exceed 75 degrees Fahrenheit, F, and humidity must not exceed 70%. According to industry guidelines, how frequently must the technician monitor and formally document these environmental parameters to prevent the degradation of packaging materials? A. At least once per month during the formal departmental audit. B. At least once daily to ensure conditions remain within the acceptable range. C. At the beginning of each week before the first surgical case. D. Only when the digital thermostat alarm sounds. Correct answer B. Knowledge point explanation. Core rationale. Environmental parameters are critical to maintaining the shelf life and sterility of processed items. Temperature and humidity logs must be checked and documented at least daily. Some facilities prefer every shift to ensure a rapid response to any HVAC system failures. Trap analysis. Option A is incorrect because a monthly check is severely inadequate. Major environmental fluctuations could ruin hundreds of sterile packages over 30 days undetected. Option C is incorrect because weekly tracking leaves multiple days unchecked, violating standard compliance. Option D is incorrect because proactive manual logging is required. Relying solely on an automated alarm does not constitute formal daily documentation. Concept extension. If humidity levels exceed 70%, standard packaging materials can absorb the moisture, drawing bacteria through the paper matrix in a process called wicking. Question 6. A technician starts their morning shift in the sterilization area. They must test a 270 degree Fahrenheit, F, dynamic air removal sterilizer using a specific U.S. Food and Drug Administration, FDA, cleared Class 2 chemical indicator. What is the name of this required daily test? A. A biological indicator, BI, process challenge device. B. A Type 5 integrating indicator test. C. A Bowie-Dick test. D. A routine leak diagnostic test. Correct answer C. Knowledge point explanation. Core rationale. The Bowie-Dick test is uniquely classified as a Class 2, or Type 2, chemical indicator designed specifically to detect air leaks and inadequate air removal in dynamic air removal steam sterilizers. It must be run daily in an empty chamber. Trap analysis. Option A is incorrect because a BI proves lethality using live spores, not a Class 2 chemical indicator for air removal. Option B is incorrect because a Type 5 integrator reacts to all critical parameters of a steam cycle to monitor instrument loads, not to diagnose the vacuum pump's daily performance. Option D is incorrect because a leak test is a physical pressure test, not a Class 2 chemical indicator test. Concept extension. If a Bowie-Dick test fails, shows uneven color change, the sterilizer must be shut down, checked, and retested before any instrument loads can be processed. Question 7. Which of the following activities is officially classified as a type of formal monitoring within the Sterile Processing Department, SPD? A. Visually inspecting instruments for residual soil at the assembly workstation. B. Ensuring all staff members are wearing appropriate personal protective equipment, PPE. C. Recording the department's ambient temperature and humidity levels. D. Observing proper hand hygiene practices among technicians at the sink. Correct answer C. Knowledge point explanation. Core rationale. Formal monitoring involves the documented measurement and recording of specific, regulated data points, such as capturing the ambient temperature and humidity levels to ensure they meet the heating, ventilation, and air conditioning, HVAC, standards required for sterile storage. Trap analysis. Option A is incorrect because visual inspection is a fundamental step of the preparation process, but it is not categorized as formal monitoring, which typically generates a permanent log or printout. Options B and D are incorrect because while enforcing PPE and hand hygiene are critical managerial functions and part of infection control, they fall under general compliance and supervision, not formal documented environmental or equipment monitoring. Concept extension. Other examples of formal monitoring include recording minimum effective concentration, MEC, test strip results for high-level disinfectants, and logging biological indicator results. Question 8. A technician has just finished running a load of orthopedic instruments through an automated washer disinfector. To formally verify that the thermal disinfection phase reached the required 194 degrees Fahrenheit, F, which physical monitor must the technician review? A. The thermostatic valve on the equipment's internal plumbing. B. The chemical indicator strip placed inside the wash rack. C. The digital or paper printout generated by the machine. D. The water hardness test report from the main supply line. Correct answer C. Knowledge point explanation. Core rationale. Physical monitors on automated equipment provide real-time, objective data regarding the mechanical parameters of the cycle. The printout is the specific physical monitor that proves the washer disinfector achieved the exact time and temperature parameters necessary for thermal disinfection. Trap analysis. Option A is incorrect because a thermostatic valve is a mechanical component that regulates temperature. It is not a monitoring output device that the technician can read to verify cycle success. Option B is incorrect because a chemical indicator is a chemical monitor, not a physical monitor. Option D is incorrect because water hardness testing is a manual chemical test of the water supply, not a physical monitor attached to the washer disinfector itself. Concept extension. The operator must review and initial the printout at the end of every wash cycle to legally document that the thermal disinfection parameters were met before handling the instruments on the clean side. Question 9. How frequently must the floor screens inside a mechanical cart washer be routinely inspected to prevent debris from clogging the drain and impeding the wash cycle? A. At the beginning of every single automated cycle. B. At least once daily. C. During the weekly preventative maintenance inspection. D. Exclusively at the end of the final evening shift. Correct answer B. Knowledge point explanation. Core rationale. Cart washers process large, heavily soiled items that can easily deposit tape, plastics, or large debris into the chamber. To maintain proper water flow, impingement pressure, and drainage, the floor screens must be checked and cleaned at least daily. Trap analysis. Option A is incorrect because checking the screen before every single cycle is operationally inefficient and not mandated by standard guidelines, provided a daily check is performed. Option C is incorrect because waiting a full week would likely lead to severe clogs, flooded chambers, and failed cleaning cycles. Option D is incorrect because while it can be done at the end of a shift, it is not exclusively done then. The requirement is at least daily, which can occur at the start or end of the day depending on facility policy. Concept extension. Routine daily maintenance performed by technicians, such as cleaning screens and wiping down gaskets, is critical to preventing costly downtime and ensuring equipment longevity. Question 10. After running a steam sterilization cycle at 270 degrees Fahrenheit, F, and incubating the biological indicator, BI, for the required time, the technician notices the fluid inside the vial has changed to a fluorescent yellow color. This positive BI result indicates which of the following? A. The incubation process was successfully completed without any equipment errors. B. The sterilizer effectively achieved lethality by killing all highly resistant bacterial spores. C. There is bacterial growth in the ampoule, meaning the sterilization process failed. D. The chemical integrator inside the test pack reacted properly to the saturated steam. Correct answer C. Knowledge point explanation. Core rationale. A positive result on a processed BI means that the Geobacillus stereothermophilus spores inside the vial survived the sterilization cycle and multiplied during incubation, causing a visible color change. This is a critical failure indicating the load is not sterile. Trap analysis. Option A is incorrect because the color change indicates a sterilization failure, not merely the mechanical completion of the incubator's timer. Option B is incorrect because lethality, killing the spores, would result in a negative read, no color change/no growth, not a positive one. Option D is incorrect because a BI color change is a biological reaction caused by living organisms metabolizing the media, entirely separate from how a chemical integrator melts or changes color. Concept extension. A positive result on a test BI requires an immediate recall of all items processed in that sterilizer since the last known negative test result.